trust funds and what have you, if you get healthcare guaranteed through CalCare, you can use that money for something else. You can use that money for more vacation days. You can use that money for a better retirement. You can use that money for other things to take care of your family. You can negotiate and use the money for down payments for a home. You can use that money for so many other things. So we want to ensure that our union brothers and sisters know that we're going to take care of them. We're going to protect them and protect their pension funds. And that's why we have more unions on board than we've ever seen before in a single payer bill that's come before the California legislature.
So, what are the concerns of your colleagues and how do you address them?
Well, the concerns of colleagues understand, and it's understandable, is kind of the fear of the unknown. It's like we're going to completely change the way in which we pay for our health care. We do have a complicated, expensive multi-payer system. No one denies it. My colleagues don't deny that. But I think the fear is that what people do have, that they're going to lose. And so even though there's millions that don't have health care or are underinsured, there are plenty that actually do have insurance and do get their needs taken care of. And so there's a worry, okay, well, what's going to happen? How do we ensure that we don't lose what people are getting? And so that's what we're trying to explain to them, that in this system, because of the money that we'll save, we can ensure that there's not going to be a drop in coverage. In fact, under the Medicare waiver program, the only way that money comes in for the federal government is you have to guarantee that you're not providing less care with that money than individuals are currently getting. That's part of the law. And so, my colleagues don't know the nuts and bolts and ins and outs in as much detail as I do. So I don't want to criticize them or fault them for not jumping on board or not being co-authors and what have you. There's a lot to learn about it. It's a very lengthy bill, but I have been meeting with many of them. I've met at this point with about already at least half of the Democrats and talked to them about it. And I'm having meetings continuously between now and hopefully when it gets to the floor. And so I feel very confident we're going to get enough of our colleagues there to at least allow us to continue this bill to the Senate and continue working on any issues they might have.
Yeah, I appreciate your graciousness with that because for me, a layperson who's read the bill, what you stated seems pretty clear if they were to read the bill. And, we heard Assembly Member Jones Sawyer talk in the Health Committee about, okay, so he's in the legislature. He said he has the Cadillac of health insurance, and yet the health care is still difficult and lacking. And you would think that these legislators would understand that this bill is going to benefit them personally and their families. And there are people in their offices that work for them.
Yeah.
They're your young people, your aides. So hope that they do understand that. Of course,
Hope so.
some people believe that although Governor Newsom campaigned for single payer healthcare and when he was campaigning for governor in 2018, that he really does not want this bill on to reach his desk, and that's what's really behind this, because after all, it is in the California Democratic Party platform. This should be easy. This should not be such a struggle. I would say, even with what you brought up, them not understanding, when you point to the law, by law, you have to provide at least what you have, if not more, to replace the system.
Yeah. It's hard. I mean, look, to Reggie's point, it's true. They try to claim that there's these long wait lines and waits in other countries. Well, we have a long waits here, and we have the longest wait. If you don't have insurance at all, you never get it. So I don't think anything's longer than that in terms of waiting. Secondly, it's true that there are some colleagues that are still doing their research, and there are some colleagues that may just not support it at all, and there are some that are just scared. The industry is very powerful. They put a lot of money into campaigns. They also put a lot of money into attacking us if we don't do what they want. Unfortunately, we've created a political system that has opened up the floodgates of money, and that with it brings consequences. And so, I think that we have to reassure my colleagues that doing the right thing is not going to harm them. We know, quite frankly, with the Affordable Care Act, when it was passed, there were Democrats that lost their seats because they voted for it, because the industry came in so hard. So it is a real fear. But ultimately, many of those Democrats that lost their seats didn't regret it one bit. Because they know that they were saving lives by doing it. And the Affordable Care Act has saved lives. There's no doubt about it. With single payer, we can save even more, a lot more lives, and prevent folks from going into bankruptcy. And so we have the opportunity to be bold and do the right thing. And I'm hoping that my colleagues will be bold.
Last question before we close. We know you are friendly with Assembly Speaker Rivas. Do you know where he stands on CalCare? He's pretty key in.
Yeah, look, I mean, he was a former co-author, 1400, he voted for it. And he actually substituted in Health Committee and voted for it on appropriations. But he's in a different role now, and he's not in a role where it just matters what he thinks. He's, I'm sure, getting inundated on a lot of bills from a lot of colleagues. And so, I'm hopeful. And the other factor, quite frankly, is that the last few years we had a massive surplus. We're in a deficit. I know, because I know folks are going to probably be we're yelling out now like, well, this is not about the budget. It's not, because I try to tell folks and convince them that this bill is not about the year-over-year budget. And in fact, it makes it clear that it doesn't go into effect until the financing is figured out through other mechanisms after we get waivers approved. That being said, there is this cloud over appropriations. And so I'm sure there's a lot of feedback. And so we need to make folks out there are giving feedback to their legislators, whether they're on appropriations or not, and to the Speaker's office, and to other colleagues in the districts they live in, saying, hey, this matters to us. We want it to get to the floor for a vote. And so let's get the feedback as much as we can. He's absolutely a decent human being that believes in healthcare and healthcare justice. But again, his role is different now. And so I want to be respectful of that, but also implore him to ensure we get this through appropriations and onto the assembly floor.
Well, Assemblymember Cara, speaking as the chair of Healthcare for Us and on behalf of my co-hosts on this show, I can say we are incredibly grateful that you are the author of this bill. We are so proud that you are the author of this bill. Your intelligence, your combination of heart and head, your fierceness when it comes to this bill, we believe no other legislator would match that. So thank you for leading this movement with us, and thank you for talking with us.
Thank you. I appreciate it. Thank you so much.
You are listening to member-subscribed People's Radio, KPFK. We are the bi-monthly show, Healthcare for Us, talking about single-payer healthcare and how, with your help, we can get it in California with CalCare AB 2200. KPFK can be found on the radio at 98.7 in Santa Barbara, 93.7 San Diego County, 99.5 Ridgecrest, China Lake, and right here in Southern California, 90.7. We all just listened to a pre-recorded interview with our wonderful Assembly member, Ash Kalra, who is the author of CalCare AB 1400.
AB 2200.
Oh, I'm sorry, AB 2200.
Maureen went back in time.
Yeah, and AB 1400, both. No, AB 2200. And now we're going to have a little discussion about that.
Yeah, ladies, I want to know what you think. What are your thoughts? Go right for it.
Well, one of the things I loved is in the beginning when Ash went to talk about how, because of racism, Medicare was the alternative to single payer. So I say that for racial justice, let's flip it and let's make AB 2200 replace Medicare for the sake of racial and social justice.
I
Right?
love that.
I love that.
It's a reparations bill. I don't understand why the reparations task force hasn't included AB 2200 yet in its list of bills for the year. There's 13 bills running this year with reparations, and this is definitely one of them.
Well, in the reparations task force report, it does, one of the core demands is universal single payer healthcare in California. So it is very specific. So yeah.
Yeah. Another thing I think is really interesting that Ash pointed out was the financing piece, right? We're talking about being in a deficit this year, which is already wild considering we had an enormous surplus last year.
Where'd our money go? Oh,
Where
to
did it-
United Healthcare.
I know
To
where it went.
Cigna.
It went to the new 14 billionaires in the healthcare industries.
Oh,
That's
Wow.
where our money went.
Wow.
I think it went to that French Laundry dinner.
Oh, that too.
But the point he's making is a good one because this is the policy bill. We're not even going to be looking at paying for this bill for, come on, at best 3 or 4 years from now, right? So as we've seen, we can go from $100 billion surplus to a $27 billion deficit in 1 year. So we
And-
don't even know where our budget will be in the next 3 or 4 years.
Such a good point, Gina. And it's appropriate that this is a policy bill, which means there's no money. It costs nothing right now. And the reason why that's appropriate is because that's what's mandated by the federal law. We have to pass the policy bill first before we can get the federal waivers and decide exactly how much money needs to be raised to fully fund this. And there is a safety mechanism in the bill that says it will not take effect until all the funds are in the account. So it costs nothing, $0. So budget deficit, it doesn't mean a darn thing.
It costs
it comes to this
political
bill.
will is what it costs. And I think we all should be paying very close attention to how folks vote on this bill.
Yes.
Because for me, if you don't vote on this bill or you sit this vote out, so you're abstaining, you shouldn't have your seat next time around.
I agree. This is life and death.
Right.
This is life and death. And this is solvency or impoverishment for families. This is seniors being able to keep their home or lose their home
Right.
because they got sick.
Right.
That's what this is about. You know, one of the things I love that Ash said, because I have been in this for 20 years, is that this is a movement, right? And it's not a moment. So and I will tell you, we have made progress. We absolutely have made progress.
22 co-authors.
Yes.
That's progress.
Yes. And, you know, the first bill was in 1997, and it was Barbara Lee and Diane Watson, 2 Black women here in LA who introduced the first bill, which got amended into something completely different. Oh, into a conversation bill. That's right. And a study bill. So one of the
We
things
don't need any more studies.
No.
Barbara Lee said it. She said it loud and proud. It's actually on our Instagram, her saying, we don't need any more studies. We've done the studies.
Yes.
What we need is CalCare.
And, you know, we have the data. And that's one thing that's different too now, is that now we have collected data that shows us exactly where the deficits are in our healthcare system. It shows us that we are losing life expectancy. It shows us the disparities. It shows us the greed of the interlopers, the intermediaries that are sucking money away from our delivery of care. We know this now. We have this knowledge. Not only do we have the knowledge, but we have the social media where people can find this information. And
That's
one
right.
of the places you can find it is right on our website, hc4us.org. You can find all this information right there. So that is very, very different. And the third thing I think that is really different is that because of corporate greed, so many more people are suffering so much more. When I was young, people did not lose their homes because they got sick. People were not thrown into debt because they got sick. People could go to the dentist and not end up with, you know, huge bills and medical debt because, you know, they needed tooth repair. I mean, this is what's different. And that greed is not on halt right now, folks. That
Oh,
greed
no,
is,
it's on steroids.
it starts, it is continuing. And the longer we sit with this dysfunctional system, the longer we sit with that, the more people are going to suffer.
And that's why you got to tune into this show, because this is one of the few places we're talking about this. You're not getting this anywhere else.
Although, you know, I will say there are younger people now on TikTok, on the social media that Maureen mentioned, making clips about this.
Well, thank God.
Folks are picking it up. You know, Ash made a really funny TikTok about how the medical industrial complex was coming for him.
Oh,
Now that the bill's been introduced, And he says, am I scared? Not one bit. I can't do it as well as Ash did, but that, that went wild on our TikTok, and young people started saying, well, what does this mean? What is single payer? So the conversation is being had.
And it needs to continue to be had, because in the light, we can expose this and make change, and in the dark, we cannot.
It's true. And, fear, he mentioned fear a few times, fear that the legislators have, fear that, ordinary citizens have. We cannot let fear drive us. Folks, the antidote to fear is information and knowledge. What I say is that anyone opposing AB 2200 CalCare just doesn't know what it says. Okay.
Or
You-
they're taking money from the medical industrial complex.
Yes. But
Could be that too.
yes, that's true. But you cannot possibly be against this
No.
if you know what is actually in the bill. So please educate yourself, folks. Thanks for listening to us, but go onto our website and really read and understand what is in this, because I see emails all the time where people are being sold, fear-driven messages, especially people that have, union healthcare. They say, oh, I can't lose this. You will not be losing anything. You will be getting guaranteed everything you have and more.
People are afraid of losing the tiny bits of scraps of healthcare that they have
And the
access
funny
to
thing
at
is,
this point.
it's literally the equivalent of, like, we're moving you in from a 1-bedroom apartment to a 4-bedroom house. So yeah, you're losing the 1-bedroom apartment, but you're getting a 4-bedroom house. Like,
You're getting
getting
dental,
so-
you're getting mental health, you're getting substance misuse, you're getting vision.
long-term care.
Right.
Yeah. And, sadly, money means power is the message we're getting. And we need to switch that narrative to the people mean power. People must assert the people's power against that money power.
Well, we've talked a lot about what's going on, and now we're going to switch to some actions that you can join to help make this bill happen.
Yes. Tonight, Monday, May 13th from 7.
Tonight.
Yeah, tonight, folks, join us again.
Tonight.
Join us for a Healthcare for Us deeper dive into the amazing CalCare AB 2200 bill. Our panelists will break it down and share why you too should be so excited about the passage of this legislation and be willing to make those phone calls to get it. And you can register on our website, hc4us.org/Zoom. Also, today, Monday, and tomorrow, Tuesday, are the last call for you to call the assembly members in appropriations to vote yes on AB 2200 at Wednesday's Assembly Appropriations Committee meeting. They will be voting in 2 days. So to move this bill forward, our calls are needed to publicly pressure those not yet in favor for a yes vote and to give support to those already with us for a yes vote. Our website has an easy drop-down menu to make the calls individually or automatically. Calls just take a minute or less. If staff states that you are not a constituent, remind them this is a committee representing all Californians. Find the numbers and simple script on the Take Action menu /CalCare at our website. Once again, hc4us.org/CalCare now. Now, if CalCare AB 2200 passes appropriation, it moves forward to the full assembly vote, May 24th. So continuing actions of support and pressure are essential. Calling your assembly members is a must do. It's also not too late to sign the petition. Get any organization you are affiliated with to endorse CalCare. Schedule a ledge visit with an assembly member. We have people making those visits this morning. Schedule a presentation for your group. We just did one this weekend. We're happy to come and talk to anybody. So, or table this week at a farmer's market or on any sidewalk location. And it is easy to remember that everything you need is at hc4us.org. If you've missed any of our past shows, they are archived on our website, along with the show news articles, calendar events, and so much more. We want to hear from you. Send us your comments, your questions, your show topic ideas. Contact us at info@hc4us.org. Please follow us at all the socials, HC the number 4_org on all the socials, X, Instagram, Facebook, TikTok, and YouTube. And please remember to donate to KPFK, our only community radio station that keeps voices like ours and so many others alive and on the air.
Thank you, KPFK, for letting us have this show. Thank you to our guest, Assemblymember Ash Kara, Board Operator Wendell Handy, Music and Tech Producer DJ Scott of thebootycorns.com, BolsaChicaDesigns.com for our show graphics, the Healthcare for Us Board members Dennis Resendez, Carol Fodera, Paul Newman, Sheila Bates, Cheng Sim Lin, James Sarantinos, and the entire Healthcare for Us team that make this show possible. Healthcare for Us airs every second and fourth Monday at 1 p.m. Our next show is on Monday, May 27th. Stay tuned now for the Scholar Circle up next on KPFK. And remember, single payer is the solution.
Join the healthcare revolution!
I love it too. Single payer healthcare is coming through. I said I like it. I love it too. Cause we're all covered. Yes, me and you. I like it.